Brain injuries can result from a blow to the head, a penetrating injury to the head, or exposure to forces that cause the head to snap forward and then back. Brain injuries include bruising of the brain tissue, bleeding into the space between the brain and the skull, and concussions. A concussion is a traumatic brain injury that alters the way the brain functions. Concussions can occur anytime a person experiences a bump, blow, or jolt that results in rapid movement of the brain within the skull. Signs and symptoms of concussions and other brain injuries include the mechanism of injury, which means the method by which the injury occurred. A change in mental status, for example, confusion, disorientation, memory loss, or loss of consciousness. Dizziness. Vision changes, such as blurred vision or double vision. Nausea or vomiting. Seizures. Loss of balance or stumbling. And the inability to do activities that the person could previously do. It is not always easy to tell if someone has a concussion or other brain injury. Although a person may show signs and symptoms immediately or very soon after a blow to the head, in some cases it may be hours or even days before signs and symptoms are seen. If the mechanism of injury makes you think that a concussion or other brain injury is a possibility, it's best to treat the person as if they have a brain injury, even if they aren't showing signs or symptoms. Advise them to stop their activity immediately and make sure 911 has been called. Also, keep in mind that any impact significant enough to cause a brain injury could also cause a spinal injury.